Good morning, everyone. Wynn Brown here on Friday, March 27th for our Haywood Healthcare morning COVID-19 update. I just want to let you know I just came out of Incident Command with the entire team that's working tirelessly to make sure that we are on track with everything we need to do to take care of our patients in our community. I just wish you could see the talent in the room, the incredible ingenuity that people have, their dedication and commitment and leadership. It really is an amazing conversation that goes on each day as we continue to navigate our way through this pandemic. So I just want to thank all of those folks that are honestly working 18+ hour days every day, 7 days a week for the most part. It's hard to unplug from this if you're a leader in the organization. I just want to give a shout out to our Incident Command team who's just doing yeoman's work. And so thank you very much to everyone working on that. I know right off everybody wants to know what are the numbers, what are we looking like. To date, we have tested 256 patients for COVID-19. Remember, that's inpatient and outpatient numbers, 77 negative results, no virus detected so far. We are at 12 positive patients so far today. Another one just came through this morning. Just to give you a sense of how the pandemic is escalating across Massachusetts, number of confirmed positive cases over the course of this week so far. So on Monday, 777 cases in Massachusetts. Tuesday, 1,159. Wednesday, 1,838. Thursday, which would be yesterday, 2,417. 200 as of yesterday, 219 patients are hospitalized who have tested positive. That doesn't even include the rule-out patients that we have in beds, and there have been 25 deaths in the Commonwealth so far due to the pandemic. So just to put us in context with the rest of the state. On an inpatient basis, we have 8 patients in bed who are rule-out patients or patients under investigation who have signs and symptoms, but we're waiting for their definitive test results. And we have 6 patients in-house at Haywood as well who have tested positive for COVID-19. So we have 6 patients in-house. And just a shout out to the team members who are taking care of those patients. It's incredibly stressful, incredibly hard work, and I just admire the dedication you have to make sure that everybody is well cared for. Just a reminder that there have been some questions about our partial hospitalization program. That continues to be up and running. We are providing regular teletherapy and telepsychiatry services through that, so that still can be accessed. If you have any questions about that program, you can speak with Josh Diggins or email Josh, and he can give you any information you need. Also, an email went out this morning regarding CSO, clinical support options out of our Athol campus, who are very willing to provide behavioral health support for anxiety and everything else that you might be facing in dealing with this pandemic. And so that information is in your email, so I encourage you to look at that. Also, I know there have been some concerns that while everybody's still getting paid and the checks are going to direct deposit, that you can't see some of the information that you want to see that typically would come on a hard copy check or a fake check that we send you, but it has all your information on it, including ETO and benefits and those kinds of things. And so teams working today to see if we can come up with a interim electronic version, a software solution that we can provide that to you virtually, and so stay tuned for that. I know that people are concerned about that. On Sunday, I'll be able to report to you sort of the definitive, not sort of, it will be the real thing, the definitive cafeteria plan to support staff and providing food on the 2 hospital campuses and on our satellite campuses. And so the team's working hard to get that set up. It's just it's a good infection prevention measure that we're taking, and it's also just a way for us to say thank you to everyone by providing free meals to support you during your shifts. So stay tuned for that. Tune in on Sunday. There has been a couple questions that have come in over the internet from local residents curious to what happens if someone does test positive. Who does all the tracing of the contacts in the community that a patient might have had? And that really is a partnership we have with our local boards of health making sure that that patient tracing happens, and making sure that we can let people who might have been in contact with that patient so that they can take precautions. So a shout out to our Board of Health. We don't have huge staffs on any Board of Health in any of our small communities, and so they are working overtime to support us in that endeavor. So that's the news from my vantage point this morning across Haywood Healthcare. I'll be back to you tonight with our evening update, and we'll have more to report at that point in time. So it is a beautiful day outside. I hope that if you're working at any of our facilities today, that you get a chance on a break or on your meal break to get outside and get some exercise and get some walking in. Getting some exercise during these stressful times really helps us all be at our best. So do that. We're also coming into the weekend, and I hope you'll take some time this weekend with your family as well, with good social distancing from others, to get outside and get some exercise. It's spring is here, and let's take advantage of that. So everybody have a great day out there. I'll be back to you this evening. Appreciate all that you're doing today. Take care.